Hello everyone and welcome to this short session on how to take OBG history like a pro. So this is something that is super important. So whether you're in second year or starting internship or preparing for OSCEs, this 10-minute guide will set the groundwork for confident clinical performance. Alright, so let's not waste time. Grab your case sheet or notebook. Let's get into it. Alright, so the first slide starts with patient identification, also known as demographic details. These are the basics as far as any kind of history taking is concerned. So this is crucial in both exams and in real life when you start practicing. So you'll note that first thing that you'll start is with name, age, inpatient or outpatient number, that is optional. Date of admission history taking, that is also optional. You need to address or give special importance to their occupation, their address, their gender, and their marital status. Alright, so these are important in OBG in various aspects. For example, let me give you an example. If a particular patient is married for a while, and while uh, if her gravida is still 0, yeah, you can think of infertility. Alright, subtle, but it is very important. So moving on to the next slide, chief complaints. Now for the chief complaints, keep it short and in patient's own words. Alright, always ask what brings you here today. This sentence is important as you do not need to offend the patient like why are you here. That is not, professional. So the professional way of asking a chief complaint is what brings you here today, or why are you here. Yeah, so another important thing is that chief complaints need to be written in patient's own words, and you need to make sure that the complaints are in chronological order and they are short in a single sentence. For example, for example, if a patient complains that she has no menstruation for 2 months, the chief complaint should be resembling that. It should be no menstruation for 2 months. There should not be any medical term in the chief complaint. For example, amenorrhea for 2 months is not the right way to write a chief complaint. All right. And another trick or a tip that you might use is that when you write complaints along with their duration, it builds your diagnostic timeline, and lesser is the complication when you try to diagnose the illness. You can easily diagnose what illness they are facing. Yes, moving on to HOPI, history of present illness. This is something which you can write on your own words. And as usual, you need to start the patient was initially asymptomatic before. And you need to, like, before what uh, timeline the illness started. For example, the patient will say, I had this particular abdominal pain 2 months ago. So you need to write the patient was apparently asymptomatic 2 months ago when so and so started. Alright, so make sure to use this mnemonic given over here, right? This particular mnemonic given over here for a clinical diagnosis. Alright, this is known as the Socrates mnemonic. Alright, you can expand it as follows: site, onset, character, radiation, associated symptoms, timing, exacerbating and relieving factors, and severity. Alright, make sure that you expand on the chief complaint given. Alright, if it is taken in chronological order, explain it in chronological order as well. Do not try to jumble the order, do not try to mingle the order. Make sure it is on a particular flow. Alright, like a story, but it should be crisp enough. Do not elaborate the story to such an extent that it goes 1 or 2 pages long. Alright, I've seen people do that. Please don't do that. Alright, so this table is something that you can focus on. Pretty sure it is self-explanatory. Since this is a short session, I'm not focusing on the table, but I've made sure that it is, self-explanatory as well. So, moving on to obstetric history, here you have to record the data in such a way as given. Alright, GPLAD. G stands for gravida, P stands for para, L stands for life, A stands for abortion, and D stands for death. Gravida means the number of pregnancies that the woman has had. The para are the number of pregnancies that had led to a delivery. L means for life, the number of fetus that had the boon to become viable. A stands for the number of fetuses or the number of pregnancies that had led to abortion. Yeah, so it can be either voluntary or involuntary. D stands for death. So death is something that occurs after parturition. Okay, so abortion is something that happens before parturition. This difference should be kept clear in your mind. All right, so there are certain scenarios, yeah, you might consider whether an abortion can be included in the L column or not. So if the fetus is viable and then it is aborted, both columns are tallied. But if the fetus is not viable and due to any genetic malformation, it has to be eliminated so that it does not affect the mother. L is not tallied, whereas A is tallied. Alright, so we will discuss about Nagel's rule now, by discussing the concept of calculating end due date by using LMP, last menstrual period. Right, for example, we have example of an LMP, yeah, as 20th September 2018. Yeah, this is a date for a particular reason. Yeah, so what you need to do is you have to assume the fact that the parturition or the delivery occurs at the time period of 9 months and 7 days from the LMP. Alright, so menstruation eventually stops when pregnancy occurs. So these are the two core points that you need to consider. So what you need to do is you need to add 7 days, yeah, subtract 3 months and add a year. Yeah, because year minus 3 months is 9 months, and 9 months plus 7 days gives your delivery date, approximate delivery date. It has to be within a range. Okay, so we are giving this date in such a way that we need to be alert at the particular point. Yeah, 2 to 4 weeks at this particular date range should be kept in alert, so that this is the most accurate date in which the parturition takes place if it is a normal term delivery. Yeah, so um what essentially happens is that 27th 27th, yeah, 27th 6 2019 is your expected due date. But what if the date becomes 29? You'll get the answer as 36. What will you do? You'll just take it as follows. You need to add a month over here, and you need to take this and add it into that month. So you'll get 6 7 2019. All right, as simple as that. Yeah, sorry, does June have a 31st? Yeah, if it has a 31st, then it should be 5 7. Yeah, just make sure that you add the remainder days onto the next month. Okay, so let us move on to another case scenario. When you get a date like this, yeah, when you get a date like, let us say, 3rd Jan 2018, what will you do? You'll consider Jan as your 13th month. Yeah, Feb as your 14th month, March is your 15th month, April is just April. Okay, that comes under normal case. You need to take Jan as your 13th month, and what you need to do is you don't need to affect the year over here. Yeah, so what will you get? You'll get as, in this particular scenario, this is what you'll get. Yeah, cool, nice. Moving on to the sample table, which I'll give on the next slide, which contains how we need to jot down the details of the obstetric history from the patient. Yeah, just switch to pointer mode. Yes. Now this is your sample obstetric table. Yeah. So whenever patient gives any details about his or her pregnancy, you need to jot it down as follows: the first pregnancy, yeah, and you need to write the year in which the pregnancy was done, occurred, yeah, whether it was a normal term or a preterm, what was the mode of pregnancy, what was the sex of the fetus or the child or the infant, whether the infant was alive or dead, and what are the complications if there are any. And the menstrual history is something that you need to take special emphasis on. You need to mention about the last menstrual period, and you need to also mention the age at which the menarche took place, if there was, if there was a female who had menopause, you need to write that as well. Yeah. So also you need to write about the cycle regularity, whether the cycle occurs at regular intervals. Also you need to talk about the flow, whether it is normal or heavy or scanty. Although also you need to talk about whether the discharge is painful or whether it has any pus discharges. Yeah. And these are for a female who has not encountered any pregnancy, or if she had encountered any pregnancy, you need to ask about the prior menstrual history, right? Because of course during pregnancy there won't be any menstruation, right? So if there is pain in her menses, during her menses, you need to note that down as well. All right. So if the patient forgets her LMP, you need to ask whether it was, you can ask, for example, she might say it occurred during Pongal. Yeah. You might say like what day before Pongal. Yeah. You might ask, was it during Matu Pongal, like 2 days after Matu Pongal, something like that. Make sure you choose a particular landmark that the patient is familiar with and try to locate the approximate date range of her LMP. Alright, moving on. Sexual and contraceptive history is something that is really sensitive to be questioned. Yeah, if you're a second or third year MBBS student, you won't be, uh, pushed to ask such questioning. Yeah, but if you're a senior doctor, you need to ask such questioning. You need to ask about their sexual life, whether the coitus that they are undergoing during their pregnancy or even without their pregnancy has any pain, or how is their satisfaction, and whether any contraceptive methods were being used, or if there are any possible link to infertility, because sometimes the patient might come saying that we have tried coitus at this and so intervals, and we also waited for possible disappearance of menstrual period, but there has not been any such indications. Yeah. Moving on to gynec and medical history, you have to ask about the past medical history of the patient, whether they have had any previous illnesses similar to the one they're experiencing, or any other general illnesses in general. For example, you need to ask about hypertension, diabetes mellitus, tuberculosis. These are just some random examples. You can also ask about kidney problems, thyroid problems. Yeah. So any medical illnesses. And you need to also ask about past infertility, or if there was any infertility, what are the treatments they've undergone. Yeah. So moving on to other histories, you can include such as your surgical history, whether they have undergone any C-sections or laparoscopic methods. Yeah, drug histories, what are their ongoing medications? Yeah, do they have any allergies? Yeah, predisposed allergies. And as far as the family history is concerned, some illnesses, as far as OBG is concerned, can be familial in nature. You have to acquaint with whether any of the family members have met with the same kind of illnesses as they are experiencing right now. All right, so this can also be extended for general familial diseases as well, such as diabetes, type 2 diabetes, thalassemia, infertility, the same thing which we have discussed in past. All right. Also, you need to ask about their personal history as well. Yeah, what are their diets? Is it veg or non-veg? And what are they eating per day? Is there like, do they experience any loss of appetite, or do they experience any regurgitation or vomiting after they have eaten? If so, what is the time period? Make sure to elaborate on any kind of abnormality that they report to you. Yeah, moving on, normal sleep patterns. Do they have normal circadian rhythm? Do they do they wake up in their sleep? If so, at what time approximately? Maybe you can write it as midnight, but if they were to mention the time period, please make sure to include that as well. So I need to also elaborate on the bowel and bladder habits, whether if that is under control, or are they able to hold their union. Also, diabetes during pregnancy is called as gestational diabetes mellitus. Yeah, that is a special kind of diabetes that women experience only during their pregnancy. That is something which need to give special importance to. All right. So access to care as far as socio-economic status also matters. All right, but while elaborating these histories, frame it like a conversation. This is a tip. Yeah. If you were to approach it as a checklist, the patient will not be able to elaborate freely on any other complaints that they have, which might spontaneously come if you were to handle it as a conversation. Yeah. Okay. Moving on to uh, general and systemic examination. This is something that is not related to history. This is the next part of history taking that you should undergo if the senior doctor had told you to take these. So we will be expanding on general systemic examination in another video. And yeah, this is a summary slide of what are the most important points that you need to take into consideration here. Record the subjective parts of the clinical complaints, chief complaint and patient's words. That is really, really, really important. You might lose a lot of marks if you do not play special emphasis to that. And interpret medically when needed in HOPI. Okay, so that is something that's really important. Stay structured, stay to the point, and remain empathetic, because as doctors we need empathy, right? And make sure you practice with clinical confidence for any upcoming practitioners. Yeah. So moving on. Thank you, people. So I hope this was an informative session. Yeah, if you were to like any of the content that is being presented in this session, please make sure to drop a like, and yeah, subscribe and share it with your friends. And if you have any suggestions for me to improve in my upcoming videos, make sure to drop your questions in the comment section. Thank you, everybody. Thank you so much.